There are 8 types of disease. First of all, brain paralysis. The brain paralysis is also called cerebral palsy. It's a group of permanent movement disorders that appear in early childhood. Signs and symptoms vary among people and over time. Often, symptoms include poor coordination, stiff muscles, weak muscles, and tremors. There may be problems with sensation, vision, hearing, swallowing, and speaking. Secondly, amyotrophic lateral sclerosis (ALS), which is known as motor neuron disease (MND), or Lou Gehrig disease, is a disease that causes the deterioration and death of neuron controlling voluntary muscles such as chewing, walking, and talking. Some also use the term motor neuron disease for a group of conditions of which ALS is the most common. Have you ever seen an autism kid? Do you know how autism occurs?
Autism is also named as autism spectrum disorder. It is a type of disease related to the development of nerve brains. Autism causes an individual to experience problems communicating and interacting. Signs of autism usually appear by age 2 to 3. Early diagnosis and intervention can make a substantial difference in the future developments and abilities of children with autism. So, knowing the sign can be the best first step towards helping a child to reach his or her greatest potential. Other than that, ADHD is the short form of Attention Deficit Hyperactive Disorder. It is also known as hyperkinetic disorder. It is a type of brain disease that causes someone to become hyperactive, unable to concentrate, and get easily bored. Usually, this disease occurs in the kids before 12 years old and baby more than 6 months. For children who coexisting ADHD, treating this condition is first preferred and may result in significant improvement in behavior. Hey, where did I put my spectacles? Oh, it's here, haha. This makes me think, what is Alzheimer? So, who can tell me, what is Alzheimer?
Me. Alzheimer's disease is a disease that usually starts slowly and gradually worsens over time. The most common early symptoms is difficulty in remembering recent events. Patients usually confused, forgetful, and disoriented even in a familiar place. If the deterioration of the brain continues, patients will lose the ability to read, to write, to eat, to walk, and talk. Furthermore, Parkinson's disease is a long-term degenerative disorder of the central nervous systems, and it mainly affects the motor systems, which the structures in the nervous systems that support motor functions. It also causes tremors in the limbs, jaw, foot, and face. Patients will have difficulty in maintaining body posture and balance. Now that we have talked about 6 diseases, I wonder what the last 2 diseases are.
First, epilepsy is a disease caused by the brain cells, where the brain causing the nerve cells to produce unusual signals. People who have epilepsy may become unconscious and also experience muscle spasms. Next, multiple sclerosis. Multiple sclerosis is a disease where an individual's immune system attacks and destroys the myelin sheath in the brain and also the spinal cord. This will interrupt the transmissions of impulses from and to the brain. People who have multiple sclerosis will have symptoms of unclear or difficult speech. Now we have finished talking about the diseases. Let us move on to the drugs, alcohol, and its effects.
So, let me introduce 2 types of drugs that can affect our nervous system. Firstly, stimulant drugs is one of the drugs that affect our nervous system. Let me show the photo of stimulant drugs. It can increase the activity of central nervous system. Excessive use will cause temporary euphoria, which is a feeling or state of intense excitement and happiness, then followed by depression. Furthermore, sedative drugs or depressants is also one of the drugs that can affect our nervous system. So, this is the photo of sedative drugs. It delays the transmissions of nerve impulses and calms the mind. What are the other drugs that can affect our nervous system?
Now, let's talk about two other drugs and alcohol. There are two types of drugs. Firstly, hallucinogenic drugs, which will hallucinate its users. It will also cause the users to relieve from pain and stress. Moving on, narcotic drugs, which will delay the normal functions of the brain. A very good example of narcotic drug is anesthesia. Lastly, alcohol. Have you ever drunk Carlsberg before? It contains alcohol, which will disrupt the coordination and thinking. It also delays the transfer of nerve impulse. This, our series about the nervous system, comes to an end. Thank you for watching our video. If you like our videos, please click here to watch more. And please remember to like, share and subscribe.